This is a unique and special facility that specializes in person-centered care for youth who require intensive behavioral supports. And to tell us a little bit more about the program, I'm going to welcome up Candace Pineda. She's the executive officer of the facility. So, Candace, come on up.
Good morning, Governor Inslee, ladies and gentlemen. I'm Candace Pineda, the executive officer of Lake Burien Transitional Care Facility. I'm so excited and honored to be talking to you about our program this morning. Lake Burien is a therapeutic facility in the Department of Social and Health Services built to provide treatment to youth ages 13 to 17 with intellectual and developmental disabilities, autism spectrum disorder, and co-occurring disorders. Our mission is to support youth with complex needs by providing a safe and inclusive environment that fosters independence, self-advocacy, and personal growth. At Lake Burien, we utilize adaptive, evidence-based treatment modalities and techniques to teach skills and improves the youth's quality of life. We aim to be the bridge to the community with safety nets that lead to permanent, less restrictive, community-based settings. We really want to thank you, Governor Inslee, our legislators, and state partners for helping us secure funding to serve our complex population and our first 12 youth. Our facility is partnering with the National Association of the Dually Diagnosed to ensure that our staff receive current industry standard training. By partnering with NADD, we will have access to a broader range of resources, which we will use to enhance our services, improve youth outcomes, and demonstrate our commitment to serving youth with complex needs. We encourage youth to take an active role in their treatment here at Lake Burien during treatment and transition. Our individualized treatment plans are built around each youth's unique needs, values, preferences, and goals. These plans outline how services will be coordinated across different settings to ensure our continuity of care. Strategy and programming will include culturally relevant activities, and we will be offering education services with the partnership of Highline School District, who we will work with to ensure that our youth receive timely and appropriate public education. We offer on-site and off-site education, and this dual strategy allows us to stabilize youth behaviors and return to school in the least restrictive environment available to them. Our transitional planning process begins from day one. We know that long-term success relies upon relationships and partnerships, so we involve families and community partners in the planning process so we can ensure that our youth receive the support that they need. We offer visits to potential discharge settings to allow the youth to become familiar with their new environment and receive a sense of what to expect during their transition. The facility also arranges for follow-up care services such as outpatient therapy or case management services and medical care to ensure continued support after discharge. And we are so excited to begin working with our first youth in August.
Thank you. Well, this is a really great place to be in a beautiful state today. Of course, I always loved being in Burien. I grew up in White Center, and we always looked at Burien as the Paris of Washington. It was the sophisticated city that we put on our fine clothes to go to. But today in Burien, we are really taking a new step forward in caring for some of our most wonderful citizens. The kids who need a little extra help getting over the bar that they want to get over. And I'm so excited that we're doing things that are new and different. This is a first of its kind in our state, relatively rare across the United States. And it's a way to provide transitional help to transition kids who might have some spectrum, autism, and the like, some intellectual challenges that they have. But they're great kids and they have great futures. They just need a little help to make that transition to a full-time living situation. And we know that that can work for these young people. So the fact that we're actually putting our dollars where our hearts are with these wonderful young people is very heartening to me. And I want to thank everybody for their innovative spirit of this. You know, we're the most innovative state in the country. Software, airplanes, video games, $4 cups of coffee that we invented. And this is innovation on how we help our youth who we know can really blossom if you give them a little hand. So I'm very excited about this. These are going to be 13 and 8-year-old kids, and we know that they may not have a perfect situation in an acute care hospital, but they can in a transitional setting. So we're getting them out of a not substandard, but basically environments where they don't blossom to ones where they can blossom, so they can then take the next step into permanent living situations. And it is innovative, and it has taken people willingness to really look over the horizon to do new things. So I want to thank everybody who's been involved in this. You know, the legislature approved additional funding to make this possible. It's about $12 million. How about a round of applause for the citizens of Washington who have financed this? And I am proud to say it's a great investment because Washington citizens care about these young people. I want to thank Children's Hospital, MultiCare. This is just part and parcel of this whole new innovative approach we're taking to citizens that have mental health and behavioral challenges. Well, you know, I was very proud to open up the very first teaching psychiatric hospital in the history of the United States the other day. We have a number of other facilities we're opening up. This really is a new day of not only building capacity, but really new ways to provide and deliver services. And we did it in a hurry. You know, the Olympic facility we did just in a matter of months. That's laser speed in getting these facilities open. I want to thank Ross for his leadership in this regard. So let's celebrate this. Now I have to say one thing that kind of sad news. I don't get to have the treats that are available because I got to go do some work right now for the citizens of the state of Washington. I'm going to get a virtual tour. I won't be able to walk through it. But when you walk through there, I hope you have a sense of the great future these kids are going to have because we believe in them. Congratulations to everybody who's involved in this.
Thank you, Governor Inslee, so much for joining us today. And I want to just give a moment of gratitude to the mayor and the deputy mayor and the council members who are here from this area. Also, King County Council member Teresa Mosqueda for being here. Very, very, very much appreciate you. I want to tell you a little story. I'm a storyteller. So a little over a year ago, Secretary Ross Hunter of DCYF says to me, Hilma, I have kids with multi-diagnosis in hotel rooms. I don't know what to do. Our folks are not clinically trained to take care of these kids. What should I do? And I said, I think DSHS can help you. Let me think about this. And so my team and I, including subsequently Assistant Secretary Dr. Tonique Joseph, started thinking about a treatment model for these kids. And we even started looking at real estate. That was about a year ago. And then fast forward, and we almost got one, but it didn't quite work out. Okay, park that. About February 26th to be exact, Dr. Jeff Sparing, CEO of Seattle Children's, invited me to Seattle Children's Hospital. And he gave me a tour. And he said, Hilma, we have a problem. We have kids who should be in transitional facilities. We don't have room for all the kids that need the type of treatment that these kids need. And I said, Dr. Sparing, DSHS can help you with this. So it was the second challenge. That was February 26th. On the way home from Seattle to Olympia, we made a few calls, including to our colleagues at MultiCare, and they said, well, I said, isn't it correct that you have a facility that has a little bit of room right now? And they said, well, as a matter of fact, we do. It's up for a lease. The next day, I called Dr. Sparing back. And then I called Secretary Hunter, and we said, we have a solution. We have the answer. Fast forward, the rest behind us is history. Dr. Joseph and I and her team got together and really put together that treatment model. And then Dr. Joseph and Dr. Hunter and others, including Dr. Sparing's staff, started working hard, going out to our legislative staff and members and saying, we have a solution. And the legislature, with the support of Governor Inslee and his staff and others, approved in record time the $12 million of seed money to get us started. And then 90 days later, you're here. And today we're going to do a ribbon cutting to treat for a facility that is going to treat those children that were honestly left behind because we as a nation, because this is the first in the nation, had not been treating. This is a model in the United States, what you're going to witness today. These are diagnosed children, youth, who have been left behind. And now together we are going to do it. And kudos to every single member of the DDA staff at Lake Burien who have worked tirelessly not only to renovate the facility, but to really secure that treatment model, to hire over 100 people in record time, and to provide charters and policies and so forth to make it happen. So thank you, and thank you to our other sister agencies who have helped us along, including Healthcare Authority and the Department of Health. So now, Dr. Joseph, Assistant Secretary, the mighty Assistant Secretary, Dr. Tunique Joseph, please come over here.
Thank you guys so very much. The Developmental Disabilities Administration is so grateful to everyone of our Complex Youth Coalition partners because they came together to make this happen. This facility will help us address the critical systems gap that we have for youth and families in the state of Washington who need crisis support in appropriate facilities. The Department of Health, Healthcare Authority, MultiCare, Seattle Children's, Healthcare Authority, DCYF, our legislators, and the Honorable Governor Jay Inslee have given us the runway and the investment that we need because our families and youth are in crisis. In facilities that don't have full capability to support their co-occurring complex needs. Having a safe space for youth who have a momentary life crisis is so important. What we will do here is we will welcome, we will support, and ensure that each youth will have an opportunity to continue their education. They will gain life skills, they will see their future, they will learn about the dignity of recovery, learn what resilience looks like, and they will learn what dignity of employment and what living and the opportunities to be reunited with their families, or they're going to take flight and live in the community of their choice with freedom and independence. That's what starts here at Lake Burien. Our state partners in this Complex Youth Coalition, they've answered the call, they've committed resources, they've come to the table so that they can help build the relief that families and youth need. They no longer have to wait, they no longer have to shed tears, they no longer have to hope. It is here today. It now gives me great pleasure to introduce one of the Complex Coalition partners, Dr. Jeff Sparing from the Seattle Children's Hospital. Thank you guys so very much.
Thank you all for being here, and I'm really here obviously on behalf of my incredible team at Seattle Children's, and I see a number of them here, so I really want to acknowledge their great participation and partnership with this. But this is a great day for our kids here in the state of Washington. You all are very familiar with the crisis that we've seen in mental and behavioral health for our kids for years now, and we were seeing that trend and concerning number of children that were coming into our emergency department well before the pandemic came along. In Seattle Children's in 2018, we called for a moonshot on children's mental and behavioral health because we knew that we had to do more to increase access, to move our care upstream, and to better center our care in our communities. But I don't think any of us were prepared, obviously, for what we saw during that pandemic and the impact that it had on so many of our kids here in the state of Washington and in all of our communities. And so we did work that we could to increase capacity in our inpatient unit, in our clinics, in our emergency departments. But despite that, we all recognized that there was one major gap, and that was our kids that were stuck in hospitals, stuck in our emergency departments across the state that really needed a much better therapeutic option. And so I'm here today to thank our state officials
Governor Inslee, Secretary Manessa, Secretary Hunter, Dr. Joseph, for coming together to recognize this need. And as Secretary Manessa said, and in record time, really address something and make today possible. I was going to reference that same day and that same meeting that you all came to Seattle Children's, and a great opportunity for us to share where things were. Most importantly, though, to share ideas of like what could be possible. And we got going and throwing out different possibilities. I don't think even I expected to get a call from Secretary Manessas the very next day saying, "Hey, we've got an option," and we were all in from that moment. And it has been a great collaboration and great partnership. I think it's the best example of partnership and collaboration, what's possible when we all do come together for our kids. And to be able to do it in this kind of speed, I think even for us at Children's, we're really excited, but you told us we were gonna open this in the summer, and we're like, we're really gonna open this in the summer, and here we are, and it's been possible. And again, I think it's a great example of partners coming together, centered around a need for kids and what our state can do in ways that I've not seen any other community or any other state do. And so on behalf of all of us at Seattle Children's, but most importantly, on behalf of our kids, our families, and our communities that so need us, so need this care that's going to be available here in such an amazing therapeutic environment that's not been available for them. We're just so grateful to all of our great partners in the state, the great collaboration. This isn't going to solve everything. This is not the fix. This is our start, and we go from here, and I'm really excited about what's ahead. So thank you all, and thank you all for what you've made possible for us.
I want to thank everyone here as well, but I have some brief remarks. I'm Ross Hunter. I'm the Secretary of the Washington State Department of Children, Youth, and Families. And I have two things that I want to make sure that I correct. That new hospital that we created, yeah, that was Hilma. That wasn't me. That was amazing. Pretty exciting. The other is a couple people now have referred to me as a doctor. And yeah, that's exactly the right response. I'm a doctor like Gene Simmons is a doctor. Trust me, I'm a doctor, right? I'm a Dr. Pepper ad. So I want to speak on behalf of our entire agency about how excited we are about to see this Lake Burien Transitional Care Facility open its doors for youth with really complex and challenging needs. This moment we've talked about where Children's has kids in emergency rooms. We had kids in hotel rooms, and we were just not able to provide the kind of therapeutic staffing that we'll be able to provide here. And I'm unbelievably excited that we'll be able to open this facility really quickly, and it's an innovative opportunity. Our vision as an agency is that with the support of local resources and other agencies, like everybody here today, all of Washington's children and youth will grow up safe and healthy, thriving physically, emotionally, and educationally, nurtured by family and community. And this new facility is an incredible example of an entire community coming together to do exactly that. You've heard about the national statistics concerning youth and mental health. We're very concerned. But by carefully creating a space that puts youth at the center, we are one step closer, and there are more steps to take in this space, to tackling these multiple statewide concerns: mental health, substance use, exceptional placement for our foster youth at the top of that list, for us at least. This will provide youth in crisis a safe place to access educational service, therapy, while keeping them out of the emergency room, which as a former budget guy has to be the most expensive and least attractive place for a kid to be, out of state placements, out of other temporary unsafe accommodations. The goal here is to return home or being placed with kin or foster family for children with this kind of needs, and they need therapy for that to happen. I want to thank today the organizations and partners that helped us get here, our healthcare partners, MultiCare, Seattle Children's, as well as the Healthcare Authority, and most particularly DSHS for being able to pull this together so quickly. And I want to thank all of our lawmakers. Tina Orwell's here. I think this is your district, right? Yes, it's good to see you here. Representative Orwell. And they allocated funds to support the facility and for the parents who are also advocating for this kind of youth-centered care And we're confident that by putting youth in the center of their own treatment and offering the right trauma-informed supports, the youth that stay in this facility will be brought out of crisis and move on to do great things for themselves and for their communities. And I am looking forward to more ribbon cuttings. It's a nice thing to be able to wear a tie again. I haven't worn one in several years now. So I'm happy to do that for more opportunities like this. Thank you very much.
Well, good morning, everyone, and thank you all for being here today. And I'd like to welcome you to our beautiful MultiCare Behavioral Health Navos campus for youth and families at Lake Burien. This campus was designed to serve the needs of youth and family in our region. And so I'll tell you just for a brief moment what's here on this campus. Currently, we host our child and family outpatient program and our infant mental health programs right up the hill. And then across the way is Independent Bridge, which is an apartment community housing adults aged 18 to 25 who are transitioning out of foster care. And so we couldn't be more pleased to be able to offer our cottages to this team to provide additional fundamental services for young people. You know, events like this create a real opportunity to make a difference in developing high quality, accessible services for young people. From our work as the Seattle Children's Home way back in 1884 to the Ruth Dykman's Children's Center here, to Navos, which is now part of MultiCare Behavioral Health, we are collectively building on this legacy with our community partners in how we care for the most vulnerable populations among us. I'd like to especially thank two members of the MultiCare Behavioral Health team who have helped make this possible, Samantha Clark, who is the Assistant Vice President of Business Development, and Nathan Butts, who is our Manager of Engineering Services. Samantha, Nathan, and many MultiCare members worked closely to ensure the successful launch of this initiative. And again, we're so pleased to be a partner in this community to solve some of the significant concerns that young people are facing in our communities today. I'd like to also give a big thank you to DSHS, DCYF, and DDA for their partnership, along with Seattle Children's, and your continual advocacy across the state of Washington for this important work. It's a real privilege to participate in this mission with you. So again, I'd like to thank you for visiting our campus today, and we hope to host you again here soon.
Well, this is so awesome. I think the governor had an emergency, so I get the privileges of cutting it. Woohoo! Okay. Thank you. What do we say? Woohoo! All right, let's go.